Welcome back. I hope you have enjoyed your lunch. Today is all about possible solutions, cooperations, and the importance of finding the right path forward. And in order to do that, we need to have a deeper understanding of the situation on the Nordic labor markets. Through the project Nordic Cooperation on Integration, Nordregio provides an up-to-date overview of the current labor market situation. And this project was managed by Nora Sanchez Gassen, senior researcher at Nordregio, and she's going to tell us more about the results in a minute. And even though the pandemic is still ongoing, we have learned some new lessons that might be helpful in the future. For example, what immigrants need in order to practice their language skills and find employment. But there are also some concerns about how COVID-19 might affect the integrations for many years to come. Christian Tronstad, Research Director at Oslomet, is here to tell us more. But first of all, we'll listen to you, Nora.
Yes, thank you very much. My name is Nora Sanchez Gassen. I'm a senior researcher at Nordregio and very happy to be here. My first real-life conference since the pandemic, so this feels quite exciting. And I've been invited to tell you a little bit about a research that we've been doing, a report that we've been doing on behalf of the Nordic Welfare Center, and that came out just recently. The topic of our report you can read here, and I think this really fits very squarely with the theme of today's conference. It's integrating immigrants into the Nordic labor markets, the impact of the COVID pandemic. And this is a report that we haven't done by ourselves. We brought together a group of 7 researchers from different Nordic countries. So it's an edited volume and different researchers have written different chapters. And the report was edited by myself and by my colleague Oscar Peña, who's also here today. So the report is quite rich, lots of chapters, a lot of material, and I could only pick out a few items that I wanted to tell you about today. But if you're interested and if you want to know more, then I also invite you to read the report and have a look at the other chapters written by other authors. So here you can see the questions that we try to answer with our report, and that was agreed with the Nordic Welfare Center. First of all, we wanted to know, well, quite simply, how has the COVID pandemic influenced the labor market situation for immigrants in the Nordic countries? When we started this project in December last year, there was not a lot of, let's say, comparable information published on the Nordic region as a whole. And so we tried to fill this gap, so it would be a bit easier for us to also compare the Nordic countries and say something about the different situations. And then we were also interested, secondly, to dig a bit deeper and understand how have different immigrant groups been affected during the pandemic. Because, of course, the immigrants that live in the Nordic countries, that's a very heterogeneous group. So we try to dig a bit deeper and see what has happened there. And then on the basis of these 2 questions, we, of course, also tried to give some policy recommendations, hint a little bit about what could we do to move forward when we come out of the pandemic, hopefully. But before I start with just some of the findings from our report, I thought maybe it would be useful to have a look at the current situation. How does it actually look like with unemployment in the Nordic countries? And I hope you can see that on the slide. I've plotted here for you total unemployment in the Nordic countries. This is seasonally adjusted unemployment since 2016 and until the present, just to get an idea, what is the situation right now? And if we start, for example, in Denmark, there you can see on the right side of the figure, it's the red line here, you see the spike in unemployment that happened in 2020. So this is the impact of the COVID pandemic. But we also see how unemployment has been going down. And it's actually at a relatively low level now if we look at the timeline. We see some similar trends in Norway down there as well, and up in the corner in Iceland as well. With unemployment, it has turned around. It's going down at the moment. In Finland and in Sweden, the situation is slightly different. Here we see more of a stabilization of unemployment. We don't really see this downward trend, at least yet. And of course, we don't know what will happen in the future. Much depends on how the pandemic will develop now, what will happen in the winter, and how that will translate into the labor market and the overall economic situation. But I think we can see some positive trends here. I hope you agree. It's somewhat positive, the picture that we have here. And you might ask, well, what about the immigrants? How do they fit in here? Because this is total unemployment. This is not the immigrants. This is total unemployment. And you might ask, okay, what about the immigrants? And there the answer is they also benefit from this trend. I looked specifically at the data for immigrants. And in all the countries in the last months, unemployment has gone down. So they're part of this trend. So this is very positive. But, and then we can come with a but. Unemployment is still quite high among immigrants in the Nordic countries. This is what I try to show here. What we look at here is unemployment in the different Nordic countries in the second quarter of this year. So the second quarter here, we're talking about the months April to June. So it's late spring, early summer. This is the latest data that were available from the European Labour Force Survey that we've used. And at least in the early summer, you can see the blue bars, this is the foreign-born population, unemployment of the foreign-born population. The orange bar, that's the unemployment of the native-born population. And in all the countries, you can still see these quite substantial gaps between the two groups. Especially Sweden, I think you can see quite distinctly how high unemployment of the foreign-born population still is, 20% in the second quarter, much higher than among the native-born population. So to sum up, we do see a nice trend. Unemployment is going down. Immigrants are profiting from this, but we still not, I think we can still not be quite happy with that situation. And we can also say that these gaps that you see between the two groups, they're still higher now than they were before the pandemic. So there's still a lot of work to be done. As I said, in the report, we also tried to dig a little deeper. We looked at factors like age, gender, region of origin, sector of employment, to see a little bit how have different groups fared in the Nordic countries. And I can't tell you about all of that here. But I picked out one factor that I thought might be interesting for you. And I realized during this conference that this really ties in directly with what many of the other speakers have said. I decided to look at education and show you some of the results by education. That's one of the things we looked at. We wanted to see immigrants with different educational attainment levels. How have they been doing during the pandemic? And the answer is education matters. It matters a lot. And it seems to matter even more now than it did before the pandemic. I'm going to show you some data from the last year. So here we're looking at employment rates. We're moving from unemployment to employment, looking at employment rates in the year 2020. And we look at 3 different educational categories. Low education, this is people who have either no formal education, primary education, or lower secondary education. We have a medium category. These are people that have finished their secondary studies, perhaps with some additional training afterwards. And then we have those with high education. These are those that have obtained tertiary education. So most of them have studied at a university. And if we start to look at Sweden, I picked Sweden because we could see in the last slide that unemployment among immigrants is still so high there. So I thought maybe that's an interesting case to start with. And in Sweden, we also know that those born outside the EU have the biggest challenges in coming into the labor market. So if you pick out that group, immigrants born outside the EU, and if we look at their employment rates, you see this real clear impact of education. Among those who have low educational attainment, 40% work. If you move to those with medium education, it's already 70%, and then it's going up to 75% for those with high education. So education really seems to help. It's easier for those with high education to get into the labor market and find a job. And that is a pattern that does not only apply to immigrants, it applies to the whole population and the natives as well. I plotted those here, those numbers. You see it's a very similar pattern. Low employment or relatively low employment for those with low education, and then it increases quite substantially for those with high education. So education seems to be key. At the same time, education doesn't explain everything, because even within the same educational category, we still see differences between the immigrants and the natives. So there has to be more. But education is one factor that helps, I think these data show. And that's not just the case in Sweden. It's the case in all the Nordic countries. I put the numbers for you here now, and I know this is probably too many numbers to take in in a short time, but I can tell you that the basic trend that I described for Sweden is roughly the same in all the Nordic countries. With higher education, we see higher employment rates. Employment matters to get into the labor markets. Now, I said this is not really new knowledge. We knew that already before the pandemic. Education matters, that is important. But I compared also the numbers from 2020 with those before the pandemic. And education, this educational factor, seems to matter even more now. The gap between those with low education and with those with high education has become even larger. And I think part of the reason is that many jobs in hotels, restaurants, retail, for example, have fallen away. And these are, of course, jobs that employed many with low education. So I think this is a reason why we see even stronger gaps now. But this factor of education matters even more now. And you may wonder, why is it then that in general, those with low education have such a hard time in the Nordic labor markets? Why is it so difficult for them to get into the labor market? And one answer, of course, is that there's simply very few jobs available for those with low education. There are simply not so many opportunities in the Nordic labor market. And I hope you can see this here on this figure. What I did here is I plotted a whole range of European countries. And what you see is the share of people that work in elementary occupations. So the share of people that have simple jobs that don't require medium or high education. Jobs that you can do even without having advanced educational attainments. Simple jobs. I plotted the countries, and you see the Nordic countries, I highlighted them in different colors. And what you can see, if you see at this end, at the left end, among the group of countries here, on the left side, 4 of the 5 countries with the lowest share of simple jobs are Nordic countries. Norway, Sweden, Iceland, and Finland. So there is simply very few people in these countries that work in simple jobs. There just simply do not seem to be very many jobs available for this group. Denmark is a different story. Denmark is on the other side of the spectrum. So there it must be easier for immigrants also to get in and get a job. But the other 4 Nordic countries, they really cluster at this one end. So this is the challenging situation that we have. All the Nordic countries have considerable groups of immigrants, and between 30 and 40% of the immigrants from outside the EU have low education. So this is the group that face the biggest obstacles. That's the one side. And the other side is that there is few jobs for them. So we have this kind of matching problem that we also discussed today. So what can we do? How can we move forward now with this situation? In the report, as I said, we have different chapters, and different authors try to give different suggestions and recommendations, and I try to pull them together a little bit for you. So one thing that is of course important as we move forward is we have to see if jobs come back, if jobs in those sectors that have employed many immigrants before, hotels, restaurants, retail, tourism, if those jobs come back now and give opportunities to immigrants again. That might, of course, happen, and I think we see some of this, for example, in Denmark and in Norway. We've heard from colleagues and partners that there's almost the opposite challenge right now, that there's a labor shortage, that employers have a hard time finding staff and employees. So there's this matching problem as well. That has to be monitored. But I think even if we manage to go back to how things were before the pandemic, that is not good enough, because even before the pandemic, for example, in Sweden, immigrants had an unemployment rate of 15%, and they've had that for quite a while. So this rate was stable for quite a while. So we have to become even better, I think. So what to do? With my talk, I tried to make the point that I think we should focus on immigrants with low education. And I think I'm in good company here, because I think that was a point that I've kind of heard from different speakers today. I think we're all thinking in the same direction. Immigrants with low educational attainments, they have the biggest challenges in the Nordic labor markets. So we should focus on this group. And of course, a lot can be done. And basically, we can approach this challenge from 2 sides. The one and obvious path that we should take is, of course, increasing human capital in with those immigrants, helping them to obtain the necessary skills and competencies that are in need on the labor market. There's lots of things that could be done. Language skills has already been mentioned today. There are studies that show that immigrants who don't speak the language of their host country have a hard time finding employment. So language matters. Immigrant children is another group that we haven't talked about so much today, but studies show that in countries where there was homeschooling and distance learning, immigrant children is one of the groups of kids that are in danger, or there's at least parts of this group that are in danger of being left behind. They had a harder time to follow and keep up their school outcomes. So we have to focus on this group. That's the labor force of the future, and we also cannot accept increasing inequalities among the kids. So there has to be a focus for us as well. Adult education in all forms and formats, of course. And I also put subsidized private sector employment here. That's an active labor market policy. But we know from previous research that that has shown a very good effect. And again, I was happy to hear about the etableringsprogram, for example, in Sweden, because that is such a measure. And we know that has worked well in Sweden. But we also know from previous reports that the other Nordic countries could work a little more on that. And women could be brought more into those programs. So that is certainly something we can build on and should take forward with us. So this is the one side, increasing human capital. One could, of course, look at the other side, and I know this is much more complicated, complex, and also controversial. But one could, of course, ask, do we need more simple jobs, especially for those that have a long distance to the labor market, that we heard there are immigrant groups who can't read and write in their own language, which might take a long time to acquire the necessary skills on the Nordic labor market. The question is, do we need more simple jobs similar to other European countries to help these immigrants get a first foot in the door and get a first contact in the labor market, gain experiences on the job, and also build a network? This is a complicated question, and I think there's no easy answer here, but perhaps it's a question worth discussing. And if we say, yes, we might need more simple jobs, well, how do we get them? We have, even in the group of researchers that we've worked with, different opinions on this. So we have one chapter in our report written by the Swedish researcher Per Schedinger, who strongly argues that in Sweden more simple jobs are needed, simply because unemployment is so high that he thinks we need to do more than we've done before. He argues that lower collectively agreed minimum wages in specific sectors could be a way to create new jobs, these kind of elementary occupations, simple jobs that currently don't exist anymore, but more strongly exist in other European countries still, to create some of those jobs again. He also argues that these should be negotiated between the social partners, also to avoid that this will just be new 0 hours, very insecure jobs that do not help anyone, least of all the immigrants. And he argues that these should be combined with tax credits to reduce inequality in salaries after tax, and that they should be combined with generous study support so that people working on such jobs can study at the same time to move on with their careers, so that these jobs are just a first stepping stone. One should also say that the proposal that he makes here is not necessarily specifically directed at immigrants, because as we've seen in the data before, native people with low education face very similar challenges on the labor market. So this should be open to all. But this is one suggestion which I know is very controversial in Sweden, and it might also not work to the same extent everywhere. We have Norwegian researchers in our team who said that, for example, such a solution would probably not work in Norway. They have found out in a series of papers and projects that there is certain evidence of social dumping in Norway, where employers in specific sectors bring in migrant workers from abroad, especially Eastern Europe, employ them for a while, and when they become too expensive and gain too many skills, they are let go into unemployment and new migrants are brought in. They described such a pattern based on register data, company data, and migration data. So there is such a pattern apparently in specific sectors with specific employers. And that, of course, is not good for society or the migrants themselves neither. So they say, no, lowering minimum wages cannot be the solution. We should perhaps rather do the opposite, raising minimum wages to avoid such a situation. So this is the much more complicated, much more controversial, much more complex side of the discussion. But I think it's also an interesting one to at least discuss, to at least ask the question: do we need to do something from the labor demand side? Is that something we should consider if unemployment should remain high among immigrants as we move forward? And with that, I thank you for your attention. And I think before we start the discussion, we have Christian Tronstad from Oslo Met, who will also give us a very interesting perspective from Norway, I think.
Hello, and thank you for the invitation to come here to Sweden. It's a pleasure to be abroad again. And over the last 1.5 years, it's not so obvious that we could come to Norway, no to Sweden. So I'm really happy about that. My topic for today is in line with what Nora just told you about, but I would look more into what has happened in Norway and what kind of measures the refugees has gotten during the pandemic and what kind of results they have compared with refugees who arrived before the pandemic. One other thing about the pandemic is that the demand side is also effect is also concerned when we think about research, because during the pandemic we have had a lot of projects for the Norwegian government on different topics related to COVID-19, and the report I will present today is an evaluation of the integration package that Benedicte told you about this morning. I will not go so much into detail about the law and the legislation, but tell you more about the measures and how the municipalities reacted to the situation. This report is written by Vilde Hernes, Anne Stave, and myself. And Vilde Hernes was the project leader, so I was doing some of the quantitative analysis, but it's also based on qualitative interviews with municipalities, counties in Norway. So what is or what was at stake? I think that's an important question to start with. At least in Norway, March 2020 was a very, or we could pinpoint it to the 13th of March 2020, more or less the Norwegian country locked down. That means that people were told to go home to work, and pupils were sent home from school, at least in most part of Norway, and for a period in Oslo, for instance, most of 2020. But of course, there were regional differences. But this had a huge impact on the labor market, as Nora just showed us. The unemployment rate, which I have tried to show you here in this figure, you can see that the blue line here represents the native population, the red line, immigrants in total, and the others are for selected refugee groups, Afghanis, Iraqis, Syrians, and Somalis. And as you can see, the unemployment rate for these groups, the refugee groups, were a lot higher than for immigrants in total before the pandemic, and it soared during the pandemic. And from now on, you can see that it has, in a way, stabilized at a much higher level than before the pandemic. I think Nora was right that since the fourth quarter of 2020, the situation has improved, but still immigrants are disproportionately affected in the labor market by the pandemic. And I think one aspect of this, which we have not touched upon today, is that we also know that the immigrant population were more prone to COVID infections, but also serious events, hospitalization, and death. And I think this is also one aspect which is quite important, which I will not go much more into detail about now, but I think in some of the other projects we have had, we can see that immigrants, they are more reluctant to be vaccinated, and yes, there are some challenges in that aspect as well. And of course, this whole situation was challenging for all of us, but for newly arrived refugees with no Norwegian language skills, it was very difficult to have education from home. But it was not only the pandemic who struck Norway at this time. We had, as was talked about this morning, a reorganization of the counties from 16 to 11 counties. And this was not just drawing of a map, it was also new tasks for the counties concerning refugee settlement and counseling. And this, I think, is challenging for this policy field. And at the same time, we had a very strong reduction of refugee settlement. As you can see from this graph, from 2017 and until 2020, the number of refugees in Norway decreased substantially. And of course, you could say that it would be a much bigger problem if we had 20,000 new settlement during the pandemic. But the thing which I want to stress here is that many of the municipalities that used to settle refugees, they were now scaling down. They were thinking that, okay, we're not having more refugees coming. So it was a situation where the whole bureaucracy was also adapting to a new situation. And of course, as I mentioned, we had various infection control measures in different parts of the country in different time. So it was a very challenging situation. So what have we done in this report? It was 4 or 5 questions that we should answer, and I'm not going to go into all of them. I will tell you something about what program measures the participants have received in the introduction program during the pandemic and compare that with the situation before. And we have also looked into outcome and what kind of outcome the participants have after the introduction program, as the transition to work or education or to public transfers. And what did we find? I think the main finding is that it was a decrease in labor-oriented measures within the program. That means that it was very difficult for municipalities to find places for refugees to have work practice, language practice, or other kind of labor-oriented measures. But and it was also a challenge that it was hard to find alternative measures for work practice, because it meant that some of the cohorts within the program should mix, and that was not legal. You were supposed to stay with only a few people in your group. So it was a lot of challenging factors for the municipalities. Concerning Norwegian language training and more of the educational measures, we found that the situation was more or less stable. That means that these measures were given on a comparable level that compared to before the pandemic. But from the qualitative interviews, we understood that it was a concern that the quality of this education on Zoom and on Teams, it was not good, or at least in some municipalities reported that this was hard. When it comes to transition after introduction program, we found that the transition to employment decreased, but we found more or less the same increase in transition to education, either primary school or higher secondary school, grunnskole eller videregående skole, or higher education, which was, I think, was a positive result. We also did some regressions to control for composition of participants, and these results were more or less the same using multivariate analysis. Another important and positive result, I think, was that the transition to public transfers like social benefits there was a small increase, but not as high as you might expect when we think about the situation at that time. The group which had the highest transition to social benefits compared to the situation before was actually the highest qualified, because they did not go into education. They were supposed to go into labor market, and for them the situation was hard. When it comes to the educational measures within the program, I think the refugees with the lowest level of education had most problem following the education, the digital education. So this was the main results. And if we should try to have some lessons learned from this, I think it's an example, and it shows that the basic qualification is important, and the whole situation that we have in Norway with the huge, strong focus on lifelong learning is important, and especially when it comes to need for digital competence. This is, as probably most of us have realized, it's very important during a pandemic. And I think also it shows that it's a need for more module-based and flexible training schemes. We talked about this in one of the coffee breaks, that the educational system and the labor market, it's not so easy to match the thing together when you come from abroad and you have a different curricula. And the pandemic also showed that access to adequate digital equipment is very important, and this was not functioning as it should in many municipalities. I think the government, they funded a lot, they used a lot of money to fund these kind of things, but all of this happened very quickly, and I think it shows that it was not good enough at that time. Long-term concerns after COVID-19, when people were told to go home, they did not meet each other, and for newcomers, that will be very important, that the education and the work practice is also a place where social integration takes place, and this is of course something that they did not experience during this pandemic. We are also concerned about what's called the scarring effect of COVID-19. And this is, I think, written in a Swedish paper by Åslund some years ago about when and where matter. And what they found was that if you come to a labor market which is in economic downturn, you might have a trajectory which is more negative than if you have arrived during an economic upturn. So it's, of course, this is a concern. And I think not just concerning the labor market, I think also there is a problem for some of these refugees that the weak and poor language training that many of them have experienced, it might weaken their opportunity to pass a Norwegian test. And this test they need to have to get access to permanent residency and eventually also citizenship. So this is also one of the concerns from this. Okay, thank you very much for your attention.
Thank you so much, Christian. Nora, are you coming as well? Great. So I believe both of you are presenting really interesting results and some positive as well. Was there anything that surprised you when doing this research?
Yes, there were probably a couple of things, and I haven't talked about them here. And I also think more research is needed because I found them so surprising, so I almost don't trust them. We saw in the survey data that we used two interesting effects as regards age and gender. We've heard a lot in the pandemic that young people were those who got unemployed the most. So unemployment increased most strongly for young people. But when we looked at the data for the immigrants, in most countries, it seems to have been more the middle-aged immigrants where the unemployment increased the highest. And I'm not totally sure why that is, if maybe some of the younger people decided to go and study, for example, and therefore dropped out of the statistics, if there's something behind. But that is something we need to look a bit more deeper into. And another factor that I want to mention, because perhaps someone here can explain it, we looked into gender differences. And when we looked at employment rates for women, foreign-born women in the different Nordic countries, we saw that in Denmark and in Finland, employment rates actually increased during the pandemic. So that is, of course, surprising. You would expect the opposite to happen. So
Is there a theory about
yes,
that?
so I looked a little bit into the literature. And one thing that I found was from the last financial crisis. And then in countries like Spain, Italy, and Greece, they were of course quite hardly hit. And there they had the same effect, that women started to enter the labor market. And these seems to have been women who were before housewives and homemakers. But when then the income of the partner became more unstable, they went to the labor market to kind of buffer the family income and secure the family income. This is just a theory. I have tried to see if anyone else has written about this topic, gender differences in women coming into the labor market, and I haven't found anything. I also want to confirm this with register data, because I'm not sure. We use survey data. I'm not sure if we can trust this. But yeah, I think this is a finding that I want to dig deeper into, if this is really the case.
Yes, it's definitely interesting. And I think actually we have a comment about that here in the audience.
Wait.
I think there's a microphone coming.
Oh, yes.
Yes,
Yes.
you do.
But in the webinar, we...
Yeah, but it's interesting.
Yeah.
It's about. I was thinking. I think it was the same effect after the Second World War. Actually, that women came out into the labor market also more than before. So, I think maybe there is something written about.
So I have to stress again that I want to see this data, this finding confirmed with register data to be sure that we don't have a problem with our data. But if this should show up in other data as well, that is of course an opportunity for integration, labor market integration of foreign-born women. If they come into labor, keep them there. But we have to dig deeper into this. This is something that surprised me and I can't really explain yet.
But I can tell you're very passionate about this.
Yes.
And you will look more into it. Please come back and tell us about the results later on. Christian, was there anything that surprised you?
Not really. I think I think the pattern I showed in the beginning, that when there is a crisis, immigrants are first out of the labor market and they are last in. That was also the fact now, and this is what we have seen during the financial crisis, and so this is not unexpected.
You spoke about the lessons learned. What do you think is the most important lesson to bear in mind for the future?
I think we should wash our hands, stay with at least 1 meter, and get the vaccine. That will be very important. And of course, some of the things that have been mentioned earlier today. There are lots of good measures, like the one presented by the Swedish colleagues, which I think is sounds more or less like subsidized employment. That sounds like a good idea to expand. So, but that's more in general, not so much about the pandemic.
And you believe that we have so many similarities, which might be forgotten sometimes.
I think if you look at the Nordic countries from abroad, from a European perspective, they have so much in common, and they are considered to have, they have legislation, they have robust institutions, they have measures, they have finances. So from looking outside of the Nordic countries, everything is working in a way. But as we learned today, there are differences between us. And I think one of the main differences, which we haven't talked that much about, is that Norway and Sweden are talking about qualification and competence, and Denmark are much more concerned about quick labor market entry. And I think from the research we have done before, it looks like the Danish strategy is good in a short term, but in a longer term, it might be very expensive because people are not leaving. They have a policy that they should leave if they could, but I think they will stay. It will be difficult. And if they don't have the skills, it will be could be very expensive. But as we discussed during lunch, we don't really know the cost and the benefits of the Norwegian and Danish way of doing it, because qualifications are also expensive. And if they don't get a job in the end, it might not be such a good solution. So we will have to go on and do research to try to find the answer.
Okay, and I hope you do. Thank you so much, Christian and Nora. Thank you. So So let's move on, and now it's going to be about the young people. Because how does it affect young people to live in exile? How does it influence their education, their health, and their introduction to the labor market? CAGE, Coming of Age in Exile, is a research project which has compared the differences between refugees, young refugees, and the majority population in Denmark, Sweden, Norway, and Finland. And in this report, Denmark stands out, and it's not in a good way. Professor Alan Krasnick will now tell us more.
Good afternoon, everybody from Copenhagen, and thank you a lot for inviting me to present some key highlights from our big Nordic study on young refugees, welfare and integration. And let me share my slides with you. Here they are. I hope you can see them. The project was, sorry, I just have to see how I change here. Here we are. This is, here we have the aims of CAGE. CAGE was initiated and funded by the Nordforsk program in order to investigate how social and health inequities develop during the formative years in young refugees. We also looked into how social dimension and health are mutually interrelated, and the role of welfare policies for health and social economic equity. So these were very broad objectives, and we had 5 years from 2015 until the end of last year to work on these issues. We looked at 3 main dimensions of welfare. We looked at education, we looked at employment, and we looked at health and well-being, realizing that these 3 dimensions interact, they are mutually interdependent, and they are influenced by socioeconomic position and by contextual factors before and during migration, as well as after migration. And we had different kinds of methods for looking into these issues. We did comparative policy studies, looking into the policy frameworks. We used the excellent Nordic registers to compare data from these registers for looking into national inequalities, as well as cross-country comparisons. And we did qualitative studies in individual countries on specific research questions related to education, labor market, and health. We know that the Nordic countries have a tradition for rather similar welfare programs and services, but there are differences, and not at least in the area of migration policies. The European MIPEX program is trying to assess integration policies in different areas of migration across the European countries. And in the dimension of labor market mobility, it was clear that Denmark came out as number 7 of 38 countries with a score of 79 out of a maximum 100, whereas Sweden was the best among the Nordic countries, number 1 out of 38, so the best altogether, with a very high score, and Finland and Norway in between. And this relates very well to our general refugee approach in our national policies, with Denmark characterized as a restrictive country, Sweden as a traditionally liberal country, and Finland and Norway somewhere in between. policies change, and they change sometimes quite fast. And I like to show this picture demonstrating how Hungarian refugees were received at the Danish-German border in 1956 with smiles and coffee and Danish pastry. And after the large influx of refugees in 2015, the pattern and the approach has shifted quite radically. Now, I would like to present a few highlights from our register studies, which were focusing on refugees granted residency as children at the age between 0 and 17 during the years 1986 until 2005. And we follow these until 2015 to look into the outcomes in regard to welfare. If an asylum seeker, a young asylum seeker, came to me and asked, based on our findings, what would you recommend? How should I migrate to the Nordic countries? Well, I would have 3 advices. First of all, arrive as young as possible. An early age is better than a higher age. Come preferably as a baby. That's number 1. Number 2, bring your parents. Don't come alone. Don't be an unaccompanied minor. And thirdly, choose Sweden, Finland, and Norway rather than Denmark if you want to optimize your future welfare opportunities. Well, let's look at some of the data. This figure illustrates the completion of upper secondary education in Denmark, Finland, Norway, and Sweden, in the majority population and in different refugee groups according to age. And as we can see here, Sweden is doing better in all categories, and we see a trend that the majority population, of course, is having the best results. But if you look at the age of arrival, then the older you are, the lower completion proportion in the group. The young ones, younger than 7 years, are doing better than those arriving as late teenagers. And then how about the labor force, being in the core labor force? If we look at the population by country and gender, we here have women and here we have men. And we see that in all groups, the outcome in Denmark is much lower, much worse than in all the 3 other countries. Now, we heard earlier a very nice presentation which clearly demonstrated that education matters. And I can confirm that also from our Nordic comparisons. If we look at upper secondary education and the effect on labor force engagement, then we see that refugees without upper secondary education are doing much worse than the refugees with such an upper secondary education. And those with refugees are actually doing better than the majority population without upper secondary education. So achieving an upper secondary education really reduces the gap between the migrants, the refugees on the one side, and the majority population on the other side. Then how about being an unaccompanied minor and being outside education or employment? at age 30, and we looked at Norway and Sweden, and here we see that the unaccompanied minors, that's the yellow bars, they have much higher proportions of being outside education and employment than those who are accompanied, who are even worse than those who are in the majority population. So bring your parents, don't come alone. And then let's look at mortality, the health issues, which is the third dimension that we have been focusing on. And here we have the results where we look at mortality compared to in the refugee population compared to the majority population. And we see that Denmark and Norway is doing worse than Finland and Sweden, and also have much larger gaps between the refugees and the majority population, with a 40% higher mortality in Denmark than the majority population, whereas in Sweden we see a lower mortality than in the majority population, which is quite remarkable. And then if we look at mental health issues, psychiatric disorders and admission to hospitals for the psychiatric disorders, then we see that men in Denmark and men in Norway among the refugees have a 40% higher hospital admission for psychiatric disease than the majority population. Whereas in Sweden, males also are somewhat higher rates, but the Swedish women seem to be doing better than the majority population if they are refugees. And this might be an indication of that they are actually are less suffering from psychiatric diseases, but it might also be a symptom of admission barriers, access barriers to access psychiatric care, which is a problem of its own. Well, you might want to learn more about these data and our research findings, and you can find results in our large report, which was published by the Nordic Social Welfare Center, or you can read highlights in national language, short reports, which have been published recently, and you can find them here on the homepage of the Nordic Welfare Center. And you can be free to contact me if you would like to have more information or questions about the project. And finally, I would like to thank our partners in the Nordic countries that have contributed to this large project. Thank Nora for the funding, and the many contributors, individual contributors that have made the project possible. So thank you, all of you, and thank you for your attention. Thank you.
Professor, thank you for these fruitful insights. And let's move on in Swedish. Det görs ju en hel del insatser för att människor som står långt utanför arbetsmarknaden ska bli inkluderade. Kommunerna och Arbetsförmedlingen, de har utvecklat något som kallas för lokala jobbspår. Och det här är ett led i att tillsammans stötta nyanlända. Nu ska vi få träffa Rosmarie Gudmundsson, samordnare på lokala jobbspår i Malmö, och Nisha Shakira Katumari som är serviceassistent på Nytida Provita behandlingshem. Och hon har fått hjälp av just lokala jobbspår. Men innan vi ska lyssna till dem så ska jag också presentera ytterligare en talare. I norska kommunen Gloppen så har man lyckats väldigt väl med att integrera minoriteter. Gloppenmodellen, som ni kanske har talat om tidigare, den har ju också lyfts fram som en förebild för många andra kommuner och varit ett strålande exempel på lyckat integrationsarbete. Då undrar man förstås, vad är hemligheten bakom just det här projektet? Hur jobbar de och vad kan andra kommuner lära sig av hur de arbetar i Gloppen? Ann-Irene Festival som är projektledare för Gloppenmodellen ska berätta om det alldeles snart. Men först så är det dags för er. Varsågoda.
Stort tack för att vi har fått möjlighet att komma hit idag och prata om lokala jobbspår. Känns jättebra. Lokala jobbspår är ju ett sätt för företagen att arbeta med kompetensförsörjning. Lite kort om mig själv. Rosmarie Gudmundsson, du presenterade mig. Och jag jobbar på Arbetsförmedlingen i Malmö. Och till min vardag så har jag möjlighet då att utveckla och skapa lokala jobbspår tillsammans med arbetsgivare men också med Malmö stad som kommun. Och idag så representerar jag också DUA, Delegationen för unga och nyanlända. Och DUAs uppdrag, det handlar ju framförallt om att samverka, att stärka och främja samverkan mellan kommunen och Arbetsförmedlingen. Och utvecklingen av nya samverkansformer i den reguljära verksamheten. Så det är alltså inget projekt då. Och syftet kan man ju säga det är ju att minska arbetslösheten för dels unga men också att se till att när det gäller nyanlända att hitta arbetssätt som gör då att man snabbare kommer ut i arbetslivet. Och jobbspår är då ett sätt att jobba på det sättet. Okej, lite grann om lokala jobbspår. Man kan väl säga att det är en jätteviktig del av den lokala överenskommelsen som Arbetsförmedlingen och kommunerna har när det gäller samverkan. Den överenskommelsen ska då fokusera på, kan man säga, det som handlar om att stödja företagen och arbetet kring kompetensförsörjningen. Och samtidigt så har den ju ett jättestort syfte då att korta vägen till arbete, framförallt då för nyanlända. Lokalt jobbspår, det utgår ju alltid från arbetsgivarens faktiska rekryteringsbehov. Det är väldigt viktigt. Och vi säger att det ska vara knutet till arbetsplatsen. Och i nära samarbete då mellan arbetsgivaren och kommunen så tar vi ju fram då olika insatser som jag kommer komma tillbaka till. Det är arbetsgivaren som är med och väljer ut deltagarna som ska gå de här jobbspåren. Också jätteviktigt. Och det finns ett jättetydligt mål. Och det är att personerna som går med i jobbspåren också ska ut i en anställning efteråt. Ja, vi brukar säga att jobbspåren handlar lite grann om att matcha först och rusta sen. Och det innebär då att vi tar ut deltagarna först och sen så klär vi på deltagarna. Och utifrån arbetsgivarens behov då formar vi kan man säga en kedja av olika insatser, aktiviteter som hänger ihop och sammanhängande och det är oerhört framgångsrikt. Konkret innebär det att vi sätter ihop olika moment kan man säga då med kompetenshöjande insatser och varav utbildningsmomentet är en jätteviktig del där. Och syftet med det är ju helt enkelt då att deltagarna ska kunna få de kompetenser som man behöver för att kunna ta arbetet som arbetsgivaren har sagt att man har behov av att anställa innan då. Grunden är hela tiden kan man säga arbetsgivarens behov och kompetensprofiler som arbetsgivaren tar fram. Men det ska ju vara kompetensprofiler som är väldigt realistiska. Så vår uppgift handlar ju mycket om att bryta ner de kompetensprofilerna utifrån den målgruppen som vi jobbar med då. Insatserna som man har i jobbspåren, de finns idag hos kommunen och hos Arbetsförmedlingen i första hand. Och det kan handla om olika former av yrkesutbildningar som Arbetsförmedlingen har, delar av dem. Det kan också handla om reguljär utbildning som kommunen har. Och det kan också handla om olika språkstöd, vilket som är väldigt, väldigt vanligt i vårt jobbspår som går som en röd linje hela tiden. Och det kan handla om validering och praktik som man sätter ihop av de här insatserna då. Så individen får en bra utbildning men också insatser för att kunna ta jobbspåren. De hänger samman. Det är kommunen och Arbetsförmedlingen som jag sa tidigare som tillsammans med arbetsgivarna tar fram deltagarna i våra jobbspår. Och vi gör bara det första grova urvalet och det är alltid arbetsgivaren som väljer deltagarna sen. Vilket också motiverar de kandidater som vi tar fram, såklart. Och jobbspåret är ju liksom inte en lösning för arbetsgivaren när det gäller att lösa hela kompetensförsörjningen. Utan det är ett arbetssätt bland så många andra att kunna tänka lite annorlunda när man jobbar med rekryteringen. Och målsättningen är ju alltid, precis som jag sagt innan, det är att se till att korta vägen för individer som går in i jobbspåret till arbete, att bli egenförsörjad, jätteviktigt. Men samtidigt då möta arbetsgivarens rekryteringsbehov. Så att en stor framgångsfaktor det är ju arbetsgivarens delaktighet och engagemang under hela jobbspåret. Och att hjälpa till då att förbereda arbetsgivaren också och stötta arbetsgivaren till målgruppen som man ska träffa. Här är några siffror. Det här är bara preliminära siffror. Och det har kommit lite senare och de kommer ni få ta del av när bildspelarna går ut. Vilket jag förutsätter att det kommer göra då. Men man kan väl säga att sen jobbspåren startade 2018 på riktigt så ungefär drygt 15 000 kan man säga individer har gått in i jobbspår eller fortfarande befinner sig i någon form av jobbspår. Över hälften går ut i anställningar. Ungefär 55%. Det ser väldigt skillnad ut lokalt. Där jag kommer ifrån exempelvis i södra Sverige i Malmö. Vi har en siffra där vi ligger på mellan 70 och 75% ut i anställning efter avslutat jobbspår. Och jobbspåren kan ju vara olika långa. De kan ju vara allt ifrån 3 månader, 10 veckor upp till ett år. Så det ser väldigt olika ut. Vi har också deltagare som går vidare till studier, cirka 20%. Kanske till rena påbyggnad yrkesutbildningar. Kan man säga, så det är jättebra. Könsfördelningen känns jätteviktig. Och i detta fallet är det så att det är fler kvinnor som är med i våra jobbspår idag som det ser ut. Nu ligger siffran strax över 1700, nästan 1800 kvinnor som hittills är med då i jobbspåren. Och, så det är rätt så kraftigt kvinnodominerat. Männen ligger kring knappt 1200. Och 190 av våra 290 kommuner i landet är med idag och tar fram lokala jobbspår tillsammans med Arbetsförmedlingen och arbetsgivarna. Och det är fantastiskt. Och i de stora branscherna som vi jobbar med är i huvudsak kan man säga det är industrin, det är besöksnäringen, servicenäringen, byggsektorn. Och nu den sista tiden kan man säga att det är mycket också inom vård och omsorg. Eftersom det där har varit ett påtagligt stort behov då. Och när vi pratar arbetsgivare här, då pratar vi egentligen inte enskilda arbetsgivare. Men vi har haft idag över 900 olika arbetsplatser som har tagit emot personer idag i jobbspår. Så det känns jättebra. Okej, då tänkte jag säga några ord om ett jobbspår som vi har haft tillsammans med arbetsgivare i södra Sverige och i Malmö framförallt. Och det är ett jobbspår som heter serviceassistent. Och det startade 2020 tillsammans då med en stor arbetsgivare, faktiskt Nordens största arbetsgivare inom vård och omsorg. Arbetsgivaren Abea. Jag tänker lyxa med att säga deras namn till och med. Det är bara plus. Och de är ju ett företag inom vård och omsorg som jag sa. Och de är ett av de få företagen som faktiskt har bestämt en helt ny yrkesgrupp som heter serviceassistent. Och där har man liksom identifierat att det finns arbetsuppgifter som man behöver utföra som kanske inte behöver ligga hos exempelvis undersköterskan, för att ta ett exempel. Utan då kan undersköterskan istället fokusera på omvårdnaden medan serviceassistenten då istället då kan kvalitetshöja andra arbetsuppgifter på arbetsplatsen. Som kan handla om omvårdnad bland äldre eller i detta fallet också bland andra vårdtagare på behandlingshem. Det kan handla om matlagning, se till att vi har trivsamma miljöer på arbetsplatsen. Den här utbildningen som vi hade, jobbspåret, den var på 10 veckor. Och vi bestämde speciellt att den skulle vara för utrikesfödda kvinnor. Så det var 15 stycken kvinnor som började utbildningen. Och vi har mixat den utbildningen, det väljer arbetsgivaren själv. De tar fram vad den ska innehålla och vi har valt att den skulle vara ute på arbetsplatsen eller inne i utbildningen 3 dagar, ute på arbetsplatsen i 2 dagar under hela utbildningstiden. Och i maj då, den startade då i mars, och i maj då samma år, då gick 15 stolta kvinnor som hade gjort ett fantastiskt jobb ute, rakt ut i arbete. Och då hade vi förmånen att träffa en kvinna där, och det är då Nisha som är med mig här idag. Så välkommen fram, Nisha. Så att jag är jätteglad att Nisha kommer med mig här hit idag och tagit ledigt från sitt jobb och vill berätta lite grann mer för oss om sin historia. Välkommen fram, Nisha.
Tack så jättemycket. Hello everyone. Sorry, it's my first time to use this. I'm by name so Shakira Nisha. It's my honor to be here to share my story. I've lived in Malmo for the past 3 years. I was through migration, so it was my first year. I've just got my decision from migration, and I went to my SFE, Svenska school. So I just started like 2 months. And then I was seeing like the advertising for jobs. So I said, oh, what's happening? I have to run and see what's happening there. So when I reached at Arbetsförmedlingen, there were so many women who came to see what's happening there. And they were talking. The fact is, I didn't understand anything. Like, I was there, but the only thing I understood, if Omdoville, Stanna, the Finns, court interview. But I understood Stanna, court interview, and I said, okay, I have to stand here. Maybe there's something going on here. So when I stayed, and then I had to take an interview. And she was the lady who took the interview, and I sit in the interview, and she was like, blah, 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 talking, Rosemary, blah, blah, blah. I'm like, yeah. And then after, she's asking me, I say, the truth is, I did not understand anything, but I want to work. I need this. Yeah, because I didn't know any Swedish. I'd just come. Like, I've just studied my Swedish, like, 2 months. And I'm like, and she's like, are you kidding me? I'm like, yeah, but I want to work. And I said, okay, we're going to see what we're going to do. Yeah, so I was so happy, like, she had me through me. So I went into the program, and they had to help us to build our CVs in Swedish. And this was helping a little bit when we were doing our CV. De could prata svenska, and I was studying Swedish. I could hear new words. We did our CV, and it was so different from the CV we do in my country, in Uganda. You do a long CV like this. I went there, I did that. And this CV, it was so short. And I was like, okay, I can explain this to the employer in Swedish. So I got a chance to meet my employer, Provita Nitinda. So I did my interview, and by luck, I passed through, and she was okay with me because she could take something. If I didn't understand, she could explain it to me in English. So I went in the utbildningen, which took 10 weeks, and after the 10 weeks of my utbildningen, I could start a theory, 3 days in the week and two days in the workplace at Provita Nitinda. And after that, I got a job. And everybody would ask me, how did you get the job? I went to the interview without any Swedish, and I got the job. Yeah.
You have the right background.
Yeah. And when I reached at the job, the only thing I could say, bro, tak. But and I could avoid saying nay because they would say valfo, and I'm like, I don't want to explain myself because I didn't know. So I got this job, and it was like I could study at the same time I'm doing something. This is the thing which I got when I'm from the migration. I was so down. I needed it so much. Like, it's something I was like, I'm reborn. I was like, I have to do this with all my energy. it's like I was given a chance. So to me, it was so great. That's a little bit I can talk about it, yeah. Thank you for listening to my story, yeah.
Tack så mycket.
Yeah,
Wow, thank you for sharing.
Yeah,
Amazing
crazy.
story. I love your energy.
Yeah, thank you.
Thank you. Vi ska få prata med er lite mer alldeles strax. Men först så vänder jag mig till Ann-Irene Festival som alltså är projektledare för Gloppen-modellen. Ann-Irene, är du med oss?
Ja, hei, det er jeg. Og tusen takk for at jeg fikk lov å komme. Det var veldig kjekt. Veldig kjekt og spennende å høre på dere som har pratet før meg i dag. Og særlig kanskje de to siste som føltes ganske familiært for Gloppen-modellen.
Och nu är vi så klart nyfikna på hur ni har jobbat i Norge. Varsågod.
Ja, jeg jobber jo da som prosjektleder for Gloppen-modellen, som er en fagutdanningsmodell. Jeg har jobbet som fagleder i flyktningtjenesten i Gloppen siden 2004, og også alltid vært opptatt av dette her med utdanning, fordi at vi ser at arbeidsmarkedet krever formell utdanning, ikke bare kurs og tiltak. Og oss startet med Gloppen-modellen i 2013. Oss prøvde å snu utdanningsmodellen litt på hodet. Når oss startet med Gloppen-modellen, så var det fordi at mange av flyktningene våre kunne tenke seg å jobbe som helsefagarbeidere. Det var vanskelig å komme inn og få fast jobb. Den videregående skolen i kommunen vår, Firda videregående, hadde nettopp mistet en klasse med helsefag, så de hadde klasserom, de hadde lærere og alt det oss trengte. Kommunen manglet fagarbeidere og måtte bruke en del vikarbyrå. Kommunen har jo introduksjonsprogrammet, men vi opplevde at den fagutdannet befolkningen, helt på så den fagutdannet de som skulle ta helsefag, hadde oss rett og slett ikke mulighet til å utdanne fort nok innenfor introduksjonsprogrammet sin tid. Fylkeskommunen hadde utdanningstilbudene, men det var vanskelig for vår målgruppe å nyttiggjøre seg av den. Når vi startet med Gloppen-modellen, så ser vi jo at denne måten å organisere utdanning på gjør at de lærer fortere. De fikk knagge til å henge det de lærer i praksis. Teori og praksis følger hverandre hele veien fra dag 1. De blir raskt integrert. De får jo et nettverk gjennom jobb. De lærer normer og regler i arbeidslivet, og de lærer raskere språket. Og ser jo også at ringvirkningene for familien er jo at ungene for eksempel kan si «Å, mammaen min jobber lag med pappaen din i helgen». Og dette gjør jo at hele familien lettere blir integrert. Det er en samarbeidsmodell mellom Nav, kommune og fylkeskommune, og det er en vekslingsmodell siden det da er praksis og teori fra dag 1. Det tok en stund før vi fikk det godkjent som en fagutdanningsmodell og vekslingsmodell i Lånekassa, men nå er jo den biten i orden.
Ann, det är Helena här som kommer som ett spöke. Din presentation har frusit.
Har den fryset? Ja. Skal vi se. Ser du den som det står kvi for Gloppen-modellen på, eller?
Nej, vi ser inte den tyvärr.
Hvis jeg stopper delingen og prøver å dele den på nytt.
Nu ska vi se.
Så.
Ja, nu ser det bättre ut.
Ser det riktig ut nå? Och vi får Gloppen-modellen.
Du visar fel fönster nu. Det är bättre. Du är nästan där. Tryck på visnings... där ja, nu är du på rätt väg. Uppe till... Nu ska vi se.
Prøver den andre.
Det är synd om vi går miste om din... Vi vill så gärna se allt. Så, titta.
Vart den bäre nå?
Bra. Jättebra.
Ja, beklager.
Jag gör tummen upp här också. Bra.
Ja, hvorfor... Vi må se videre på neste. Du må se matt i alt her. Ja, Gloppen-modellen den kom jo i stand fordi at oss erkjente at ingen av oss kunne løse denne her samfunnsutfordringen enslige. Og så hadde jo en stor arbeidskraftsreserve som oss ikke kunne få nyttiggjort oss til, siden de ikke fikk fagutdanning. Men det føler oss at oss har lykkes med nå i den utdanningen som oss har startet. I 2017 så startet oss opp tannhelsesekretær. Det var etter at fylkestannlegen tok kontakt og uttrykte behov for flere tannhelsesekretærer. Det kullet var ferdig i 2020 og gikk ut med autorisasjon. De fleste av dem jobber nå som tannhelsesekretær. I 2018 så startet oss utdanning i plast, polymerkompositt og betongfag. Det var i samarbeid med næringslivet etter at de ønsket å prøve ut denne formen og kvalifisere arbeidskraft på. Og fra nå i høst 2021 så startet alle videregående skolene her i Nordfjord med videregående utdanning etter Gloppen-modellen. Så nå har vi byggfag, restaurant- og matfag, helsefag, teknologi- og industrifag og en klasse med tannhelsesekretær. Og så føler jeg jo at det viser at denne modellen kan brukes på alle de ulike fagutdanningene. Flyktninger i introduksjonsprogrammet har jo alltid vært hovedmålgruppa vår sammen med minoritetsspråklige. Men fra i høst så har vi også fått lov å ta med vanlige søkere, helt på å si, altså norske som har problemer med å følge ordinær videregående til en eller annen grunn. Så det er jo veldig spennende å få prøve det ut på en større gruppe. Når vi skal starte en ny klasse, så er det jo veldig viktig for oss å ikke utdanne til arbeidsledighet. Så oss tester ut og har undersøkelse i arbeidsmarkedet blant bedriftene våre. Hva slags yrkesgrupper er det vi trenger? Hva er det den enkelte har i sin individuelle plan? Hva er det de som er registrert i NAV har som ønske i forhold til jobb? Og så matches dette her. Når vi ser at dette her har en god match, så prater vi med de videregående skolene og ser hva type utdanning de har mulighet til å tilby. Så blir det sendt inn søknad til fylkeskommuner for å få tildelt utdanningstilbud. Skolen legger til rette for opplæring og sørger for opplæring i praksis. Og så har elevene også oppfølging fra flyktningtjenesten eller NAV etter hva de har sin saksbehandler. Når vi har fått tilbud og kan lyse ut utdanningene, så følger oss ikke det ordinære løpet. For i ordinær videregående så søker de jo med karakterer, og den med beste karakteren er den som får plass. I Gloppen-modellen så sørges for de svakeste som ikke kan nyttiggjøre seg ordinær videregående. Så vi har informasjonsmøte, kartlegger deltakerne, går gjennom de individuelle planene, vi intervjuer dem, vi sjekker ut holdninger og motivasjon, evne og vilje. Vi tester dem ut i praksis i de yrkene det går. Per nå så er det lettest å få til i helsefag, Så der har de 2 uker praksis, og praksisveilederen sier tilbakemelding veier tungt når vi skal tildele skoleplasser. I forhold til prosessen fram mot fag eller svennebrev, så det jo som sagt det 4 år studietid, og det like lenge som den ordinære utdanningen. Men oss har da programfagene i år 1 og år 2 i lag med praksis, og så har oss fellesfagene på år 3, og år 4 så har de det siste året som lærling, så da de lærlinger på fulltid. Og det blir jo også det samme på dem som har da en yrkesfagutdanning som ikke går mot fagbrev, men som går mot en autorisasjon. Det jo et 3-årig løp her, og det det også ordinært, men også her kombineres teori og praksis fra år 1. Ja, det var et lite kort innblikk i Gloppen-modellen. Det ble litt rotete når jeg gikk meg fast i denne her elektroniske fellen. Pandemien har jo gjort at vi har kunnet prøve ut litt digital undervisning også på denne målgruppa, og ser at det kan være litt vanskelig å følge ordinær digital undervisning, så vi ønsker jo å prøve ut videre fremover med litt omvendt læring og fagvideoer, så det kommer vi til å prøve på å få utviklet. Så ja, hvis dere har lyst til å se en film om Gloppen-modellen, eller håndboken og veilederen som vi nå jobber med i prosjektet, så kan dere se dem på gloppenmodellen.no. Så ja, det var et lite kort innblikk fra Gloppen-modellen. Takk for meg.
Tack så hemskt mycket för det.
Lite längre ditåt på kameran.
Annelie, medan vi fortfarande har det kvar så tänkte jag fråga, i den här processen som ändå består av ganska många olika led, vad skulle du säga är det mest avgörande?
Det aller mest avgjørende, det tror jeg det tette, gode samarbeidet, god kommunikasjon, og at den ser på holdninger og motivasjon hos eleverne.
Och om det finns någon kommun där ute som inspireras och som vill gå ungefär samma väg som ni, vad är ditt bästa tips?
Det å sette seg ned i lag med de samarbeidspartnerne som en tror, og at en vil kunne jobbe best i lag med for å klare å få det til. For vår del det jo da Nav flyktningtjeneste gjennom kommunene og fylkeskommuner. Så sette seg ned, lage gode samarbeidsavtaler, slik at en slipper å lure på i ettertid hva dette min eller din jobb.
Och finns det något misstag ni har gjort under årens gång som du tänker att det behöver inte andra upprepa?
Vi har gjort mange. Og vi har jo hatt Gloppen-modellen i drift siden 2013, så dette prosjektet kom jo i gang nettopp fordi vi så at dette her var veldig personavhengig. Det var litt ad hoc-løsninger hver høst når vi skulle starte opp. Så jeg tenker at å ha et godt planverk, forankre det i både politisk og administrativt, så tror jag att den kommer långt.
Tack så mycket för de goda råden. Jag tänker också på de lokala jobbspåren, Rosmarie. Det är ju också en process att ta sig igenom. Vad ser du som den mest avgörande faktorn där?
Ja, men jag skulle vilja säga att, precis som jag nämnde när jag pratade lite, att arbetsgivarens engagemang då. Och att de är med hela vägen i jobbspåret. Och att man får vara med som arbetsgivare och välja ut de som ska gå där. Eftersom vi jobbar ju med tjejer och killar som står längre bort från arbetsmarknaden. Då är det jätteviktigt också att vi stödjer arbetsgivarna lite grann kring hur målgruppen ser ut och att de måste tänka lite annorlunda när det gäller rekryteringen. Det är väldigt lätt att säga att jag vill rekrytera annorlunda och att man känner att man kanske vill ta någon form av socialt ansvar. Men sen när man ändå liksom bryter ner det ordentligt, då ställer man ofta samma krav. Det är därför den här kravprofilen är så viktig. Att vi bryter ner den och tänker, okej, men är man egentligen anställningsbar? Vad är det egentligen som behövs? Och våga titta på de här meriterna som våra kandidater har med sig.
Och vad är din uppfattning? Hur pass villiga är arbetsgivarna att rätta sig efter era krav, så att säga?
Men vår erfarenhet är väl ändå att vi bedriver ett par stycken utvecklingsprojekt nu också i landet tillsammans med DUA-delegationen för att titta lite grann på olika områden. Och min uppfattning är ändå att arbetsgivaren är oerhört öppen för att göra det. Det viktiga här är ju att man tänker att jobbspår är ju inte lösningen för arbetsgivaren på all kompetensförsörjning. Det kan vi ju inte gå in och säga, utan det viktiga är att prata med arbetsgivaren om att det är ett sätt att tänka annorlunda kring kompetensförsörjning och att man ska våga pröva olika saker. Och är vi då med arbetsgivaren hela vägen och koordinerar, håller ihop, berättar att det finns mycket insatser både i kommunen och hos Arbetsförmedlingen som de kan få ta del av, då känner man sig trygg. Då vill man. Då tänker man, okej, detta är ett spår vi ska prova. Sen jobbar vi med den andra rekryteringen på ett annat sätt som är det vanliga. Så att jag är jättepositiv. Vi jobbar med stora arbetsgivare. Gör vi.
Lokala jobbspår finns ju runt om hela landet.
Yes.
Hur pass mycket samarbetar ni med varandra?
Ja, det är en bra fråga. De här utvecklingsprojekten som vi har drivit nu det här året är ju tanken också att dels att vi vill utveckla och förbättra jobbspåren. Vi har fortfarande kommuner och arbetsförmedlings kan man säga enheter som inte jobbar tillsammans fullt ut. Så det vi vill göra nu är att försöka stärka samverkan mellan Arbetsförmedlingen och kommunerna så vi verkligen kan nyttja resurserna ute. Så att man kan få del av allting som finns. Öppna liksom verktygslådan. Och då har vi ju skapat nätverk nu. För att försöka fylla de här luckorna och lära av varandra, våga ställa krav på varandra. Så att vi är på framfart.
Spännande att se vad det leder till i det långa loppet, tänker jag.
Yeah.
Nisha, I believe this was a big change in your life, getting this employment. How did your life change when you got this?
Yeah. Before when I got this job, I was so down, depressed. I was always crying and I was always down. I would think because I was a nursing assistant in my country. So when I came and the way they were, the program, because we all have goals. The teacher asks you, what are your goals? What are you going to do? Then I'm like, I need to be a nurse. I need to add on my career. How am I going to go this way? And then the teachers tell you, you have to study Swedish. After this, you have to go to Grundskolan. After Grundskolan, you have to go this. And then like, how am I going to make this? Some people, they give up. They're like, oh, I cannot do this. Like, some of them, they give up. And then when I got this, I was like, this was I was reborn. I was like, okay, now I see where I'm going. This is the future now. So when I got this job, it's like, I could study. I could take care of my baby. I can pay taxes. I feel like I'm independent. I can talk. You know, when you're like, yeah, I can now say something. I can say, yes, I can pay tax. I can take care of my baby when she needs something. Again, I can study my Swedish because I have a goal. I want to be a nurse. It's like I'm going. It's just opened me like, now I'm reborn again. This is it. And I'm training my Swedish. Like when I go to school, I learn something. And then I'm coming at my workplace. And then I'm training it with them. I'm trying to say, this is it. Yeah. So to me, it was the best chance. I was like reborn. It was doing something for me, yeah.
And how does that work? To practice your language skills while you're at your workplace?
It's like, it's moving on so well. Like, you know, this, the Swedish society, there's some things you have to learn. Like, when I was home, I didn't know that people, they have to sort the garbage. And I would say, what are they doing here in Sweden? They're wasting time. How do you sort this garbage? You put this and this. And when I reached at my workplace, they tell me, Nish, the environment, you have to sort this and this and this. I'm like, this is it. The culture. Then I was learning new culture. And at the same time, I'm learning Swedish, how to make their food. Before I would say, I think the food is not good because I don't know how to make it. But when I smoke abroad. The thing is nice, yeah? Yeah. So to me, I think everything is a bit fun. Waking up like every day, I run for my bus. Sometimes it leaves me. Yeah, I feel like I'm doing something. This is me. I'm on it. I'm independent. And I'm not that person who was before always crying. I'm so down. I'm like, everything is down. Like, because everybody has a goal when you grow up. You have a goal. I want to study. I want to be something. I want to get married. But then I feel like when you come to start afresh in a country where you don't have friends, it's so difficult to make friends in Sweden. Like everybody's like, sometimes I feel like, I was like, hey, please say something to me. I want to tell you what I'm feeling. And it's like, everybody's like, yeah, so then you feel like, oh, what can I do? But sometimes you got work, it's like an escape from everything. You got work, you put everything aside, you enjoy the thing, the movement, the talking the Swedish, and like, yeah. Yeah, so to me it's like...
You don't speak English at work?
No, I speak Swedish. I try my Swedish, yeah.
I can tell you're a very strong woman.
Yeah.
Where do you find your strength?
It's like, it's not that I'm so strong. There's sometimes when I break. But I learned, when I got this job, it's like I learned one thing, the power of failure. That's the thing I've learned in this. It's like, there's something you learn in that failure when you're down, and then you say, I have to be strong. I have to start again. Now I'm in a new country. You have to adapt, move on. It's time to start again. So that's the thing I learned is that, yeah, now I'm in this. I need to be strong. I need to fight. So when I got this, it was like I'm given another chance. You know, when you have, and you find nice people who help you, push you, believe in you, it's so good. Like, and that's why I was always saying, when my boss asked me, I was like, what do you think? I was like, if you have any chance, give anybody a chance. Because I knew what this meant to me. There's someone down there who needs the same chance like me. Like to just, there's something when you feel like you just want someone to believe in you, like, you can do this.
Yes, I'm crying now.
Yeah. No, it's okay.
It's okay.
No, there's something when you just feel like you just want someone to say, yeah, they believe in you. I was so happy to be here. Every day I'm like, maybe they don't care about us. Like, but I'm seeing people are really here, like giving ideas, trying to see what's happening. There's some people there who are studying Swedish, and they're like, oh, maybe they're not caring about us. No, it's like, I've just seen like people are here trying to see what's happening and what can we do. So it gives me so like I feel so happy. Like I was like, really? Every day they just sit and just see what we're gonna do. What can we do for them? Yeah, so
Great.
that's it.
What dreams do you have for the future?
Yeah, the fact is that I'm in a country where you can be anything. Sweden, you can be anything. It's just that matter of time and not giving up. That's what I saw. It's a matter of not giving up and try to focus. There are so many challenges on the way, but it's just not giving up. My goal is I'm going to study my Swedish. Right now I'm in Swedish class C. I go in class D. I'm going to do my proof in January to go in class D. After class D, I go in grundskolan or svenska 1 or svenska 2. After that, I'll do komplettera with the nursing assistant, and I want to add on, I want to be a nurse. Maybe after nurse, I can be a surgeon, because my dream was to be a surgeon when I can operate. Yeah.
You will one day.
Yeah. I will. If I manage to be here, it's like I'm seeing where I'm going. So I think I will.
Thank you so much.
Yeah,
Isha.
thank you so
Tack Rosmarie.
Yeah, thank you so much.
Okay.